Hi everyone, today I am going to discuss about the medical surgical nursing 2 for the GNM second year. So in that we are going to discuss about the unit 9, that is nursing management of patient with the musculoskeletal disorders. So in that we are going to discuss about the congenital deformities. So in the last class we have seen about the clubfoot. So next one is congenital hip dislocation. So today topic is congenital hip dislocation. So it is also one of the congenital deformity. So what is mean by congenital hip dislocation means there is a occurs when a child is born with an unstable hip due to abnormal formation. So there is a congenital hip dislocation means there is a abnormal formation of the hip by the birth. So after the birth and there is a abnormal formation of the hip joint can be occur. So during the early stages of fetal development. So during the fetal development there is a abnormal formation of the hip joint. So it is called as congenital hip dislocation, and it is also known as dysplasia of the hip. So dysplasia means there is a improper or incomplete development of the hip. So the congenital hip dislocation also called as the dysplasia of the hip. So it is the congenital hip dislocation means there is a by the birth itself there is a abnormal formation of the hip can be occur during the fetal development. So it is called as congenital hip dislocation and also known as dysplasia of the hip joint. So next one is causes. So the causes includes the exact cause is unknown. So there is a cause is unknown. So particular cause is there is no cause for the congenital hip dislocation, and it may be caused by the low levels of amniotic fluid. So during the fetal development or in the mother's womb there is a amniotic fluid levels can be decreased. So because of the low level of amniotic fluid and it causes the congenital hip dislocation. And there is a next one is breech presentation. So the breech presentation means there is a in the normal presentation the head is become at the site of the pelvic region, and in the breech presentation what will happen means the foot and the buttocks can be instead of the head, and the foot and the buttocks can be present at the pelvic region. So it is a become breech presentation. So because of this breech presentation also it causes the congenital hip dislocation. So the breech presentation means there is a hip, the buttocks and the foot can be present at the pelvic region instead of head. So it is called as breech presentation. And next one is family history. So if the family members having any history of the congenital hip dislocation, and they are having the more chances to get the dislocation of the hip. So it is the causes. The causes is includes the exact cause is unknown, and it may be caused by the low levels of amniotic fluid, and because of breech presentation and there is any family history it also causes the congenital hip dislocation. And next one is the clinical manifestation. So in the clinical manifestations includes the legs turn outward or appear to differ in length. So the legs can be turned outside of the body and they appear to differ in length. So the length of the legs become short when comparing with the normal, and the leg is become differ in length. So the length of the hip become decreased, and it can be very small when comparing with the other leg. So the legs turn outward and appear to differ in length. So there is a difference can be occur in the length of the hip joint. And next one is limited range of motion. So because of the hip dislocation there is a limited movement can be present in the hip joint. So the movement can be limited. And next one is delayed gross motor development. So the gross motor development includes the sitting and walking and crawling. So everything is included in the gross motor development. So because of this congenital hip dislocation, the child cannot able to walk properly and sit properly, and crawling it is become late when comparing with the normal child. So there is a delayed gross motor development, means there is a gross motor development can be become late when comparing with the normal child. And next one is the diagnostic evaluation. So in the diagnostic evaluation includes the physical findings. So by the physical examination, and we can assess the any hip dislocation, and the newborn screening, and there is a by the newborn screening, and we can identify the congenital hip dislocation, and the X-ray, ultrasound and CT scan, MRI can be used to diagnose the hip dislocation. And the next one is arthrogram. So arthrogram, it is like X-ray only. The contrast can be pushed into the body to clear image of the bone, hip joint. So it is the arthrogram. The diagnostic evaluation includes the physical findings and the newborn screening, X-ray and ultrasound, CT scan and MRI and arthrogram. So next one includes the management. So in the management, it includes the Pavlik harness. Management includes the Pavlik harness. So the Pavlik harness, this is harness presses their hip joint into the sockets, and patient wear the harness for 6 to 12 weeks. So this Pavlik harness, it is like splint. So the splint, it can be supposed to the dislocated joint. So the harness, Pavlik harness, it is also same like splint, and it can helps to press the hip joint, it can be in the socket. So the hip can be located into the socket by wearing the harness. So it is like same splint, and it can helps to replace the dislocated joint in the normal position. So the Pavlik harness, it can be wear up to 6 to 12 weeks. So the Pavlik harness can be wear up to according to the severity of the disease. So according to the severity of disease, and the Pavlik harness can be used, and it can be it can be used up to 6 to 12 weeks. So next one is closed reduction. So in the closed reduction, surgery can be occurs with the general anesthesia. So under the general anesthesia, and the surgery can be performed. So the closed surgery means in this closed reduction, the surgery can be performed, and in the surgery the skin cannot be opened, and by the incision the dislocated joint can be fixed into the socket into the normal position. So in the closed reduction, the surgeon cannot open the skin, and inside of the body only the dislocated hip joint can be placed into the socket into the normal position. So surgery occurs with the general anesthesia and may include the maneuvering their hip into the socket. So by the maneuvering by the hand by the surgery, and they will keep the dislocated joint into the socket into a normal position in the closed reduction. So next one is open reduction. So in the open reduction, there is a small incision can be made to at the surgical site. So by this small incision, the hardening material can be inserted into the body, and by this material there is the dislocated joint can be placed into the normal position. So by using the instrument, and the dislocated joint can be placed into a normal position. So it is called as open reduction. In this open reduction, there is a small incision can be made, and by this incision the instrument can be passed through the skin, and it can be helps to replace the normal joint into a normal place. So if the child is become 18 months old and does not respond well to treatment, so if the child is become 18 months old and the patient does not respond to treatment, and they may need femoral or pelvic osteotomy to reconstruct their hip. So they will open the and skin, and they will remove the hip, and affected joint can be removed, and where the tendons and the obstacles can be removed in the osteotomy. So they will joint the socket and the dislocated joint in the osteotomy to reconstruct their hip. So in the open reduction, there is a tendons and obstacles can be removed to place the normal positioning of the hip joint. So the hip dislocated joint can be placed into a normal position by the small incision. So during the age of 18 months old and the child does not respond to the treatment, so then they will do the osteotomy, and they will open the skin, and there is a removes the affected area of the joint, and connected the socket and the hip joint can be connected together to reconstruct the hip joint. So it is called as open reduction. So the management includes the Pavlik harness and closed reduction and the open reduction. So the next one is the nursing management. So in the nursing management includes the nurse has to be educate to the parents about the post-operative treatment and how to use the harness. So the nurse has to be educate to the parents how to use the harness, and what are the treatment after the post-operative care. The nurse has to be educate to the parents. So the child does not keep alone, and always parents should be along with the child. So it is about the nursing management of the congenital hip dislocation.